Good morning. As we continue to battle this pandemic, we have prioritized the efforts to protect the most vulnerable members of our community, and these are residents of long-term care facilities. Our efforts to do so have greatly reduced the spread of the virus among our long-term care facility residents, and the hard work of our public health employees has been recognized by state government and federal government. So today I'm announcing that the county is adopting the new state guidelines for long-term care facilities, which allows many of them to open to socially distant visitors. We know that loneliness and isolation can be critical problems for these residents, and a visit from a family member can really make a big difference. Under the state guidelines, facilities that have not had a COVID-19 infection among staff or residents, or those that have not had a facility-acquired case in 14 days, are able to have indoor visits for their residents. For those residents who do not or are not suspected to have COVID-19 or have been released from isolation. Under these guidelines, 5 visitors may be designated for each resident, and up to 2 visitors can visit at any time with an appointment. Socially distancing must be practiced along with hand washing and face coverings. At the same time, St. Louis County is still requiring all long-term care facilities to quickly report any COVID-19 infection or any COVID-19 related death among the residents or staff. This reporting remains a crucial part of our ability to suppress the spread of COVID in these facilities and fight the spread of COVID in our community. Our health department has long enjoyed a close relationship with St. Louis University's College for Public Health and Social Justice through our academic health department, the only one in the state of Missouri. This program links the St. Louis County Health Department and the St. Louis City Health Department with St. Louis University, and all of us benefit from this partnership. Already, students and faculty at SLU are assisting us in our response to COVID-19. And today, I'm happy to announce a dramatic expansion of this partnership with SLU. Using $600,000 of CARES Act funds, our health department is contracted with the university's College for Public Health and Social Justice to provide scientific, analytic, and research support to strengthen our fight against COVID-19, capitalizing on their deep expertise in data science and public health practice. Specifically, St. Louis University will help us improve our ability to track the transmission of COVID-19 in St. Louis County and represent the state of the virus in our community. The university will work with our training staff to move our contact tracing curriculum online and to provide additional booster training for up to 250 of our people in contact tracing and case investigation. Multiple SLU faculty will add their expertise to our epidemiology, communications, and geospatial work. It will help us research and plan for an eventual COVID-19 vaccine, and will allow us to track SLU's COVID-19 app, allow us to use this app for symptom tracking and contact tracing. SLU has proved to be an excellent partner for us even before the pandemic, and now we look forward to even a deeper relationship. So I'm happy to introduce to you Dr. Tom Burrows, the Dean for the School of Health and Social Justice for St. Louis University. Dr. Burrows.
Thank you, Sam. We are really excited at St. Louis University and also the College for Public Health and Social Justice. We have enjoyed a strong partnership with the County Department of Public Health and also with the City Department of Public Health. And the partnership that we formed in 2018, as you said, is the first in the state, in the state to form an academic health department. Gives us a real opportunity to bring our 80 faculty and 1,200 students together to really tackle some of the challenges that our region and the county in particular are facing. So we're excited to hit the ground running today and look forward to all the things I think we'll be able to do together in the coming months and years. Thanks.
Thank you. Okay, I'd be happy to take any questions.
Dr. Page, like last night, obviously, the county council voted or took a couple of votes to what will in the future be restricting some of your powers and reaction to the votes this morning?
Yeah, so certainly the public health orders are difficult for our community, but our public health orders have placed St. Louis County in a better position than the rest of the state and really a lot of the country. The COVID-19 infections are headed in the right direction, and we believe that the decisions made by our public health orders, public health department and our public health experts are the right ones. If those bills make it to my desk, I'll certainly look at them, but I would be not supportive of any legislation that does not protect the health and welfare of people in St. Louis County, and I would be opposed to that.
Do you think that basically by doing, limiting your ability to act on it for just about 2 weeks, a little bit longer than 2 weeks, that would then, after those 2 weeks, make this more of a political gain than, let's say, looking out for the health of the county?
Well, we are in a political cycle, and as we saw from the presidential debates last night, this is a terrible time in our country. We are not having thoughtful conversations. We saw the presidential debate last night as a prime example. We're not having thoughtful conversations about issues in our country. And in a political cycle 30 days before an election, unfortunately, the political debate can become a bit of theater. But if any bill makes it to my desk that weakens our ability to protect the health and welfare of the residents in St. Louis County, I would be opposed to that. And I would exercise whatever authority that I have to prevent that from happening.
The first two seem to be getting the most press, but the last one, the third one they passed about the council taking over where the money goes to. Are you concerned that with a finite deadline when that money has to be spent, if the council were to take control of where that money goes, it could be a kind of chaos as to where that money should be spent as opposed to where you all have been planning it to go?
We're well ahead of the rest of the country in distributing those funds to the people who need it the most. And when that bill was passed, when those funds were appropriated by the county council, I made a commitment to direct those funds to the areas of the community that need help the most, for testing, for contact tracing, case investigation, increased access to health care. We've supported our federally qualified health centers. We have offered rental assistance and mortgage assistance for low-income families. We've issued almost $18 million of small business grants, and we're in the process of issuing support to our municipalities for their public safety efforts. And anything at this point in time that disrupts that effort to force us to go back and do more appropriations would leave a lot of people with delayed access to resources that they need at a time when they need it more than ever.
And is that deadline the end of this calendar year? As to when
Yeah, those funds have to be distributed by the end of the year. We're well on track to distribute them. We're way ahead of the rest of the country. But this conversation about the distribution of those funds has really become a political conversation, that we're in the middle of a political election cycle. And you know, a good example of the quality of the discussion surrounding this topic is the same thing you see at the top of the ticket in our country. The debate really has fallen apart, and it's really become quite political.
And changing the direction, changing the way you would be required to distribute that, let's say, 60 days before they run out, or where they have to
It would be an
spend.
enormous disruption in the delivery of services in our community at a time when people need it the most. And we'll see if that bill reaches my desk, then we'll deal with it. But I expect that over the next couple of weeks, people who have received services or applying for some of those funds and intend to distribute them in a community in the way they help people who are really struggling right now, who really need help. I believe that anything that interferes with the distribution of those funds or those ability of folks to get help would be incredibly disruptive and probably isn't a good tool for scoring political points.
There were recently 8 new COVID deaths in the county, and we're approaching 25,000 cases total. What is your thought on the trajectory of the numbers at this time across the county and those updated numbers?
Well, we have to remember St. Louis County had the first case in the state. We were hit hard early on, and we made some really dramatic decisions to slow the growth of the virus. The positivity rate in St. Louis County hovers around 5%. It's certainly better than almost everywhere else in the state. And we have 1 million people in St. Louis County, so certainly we have more cases than anywhere else in St. Louis County. But we're headed in the right direction. We're not out of this yet. We're not going to be out of this till next summer. But we hope that what we see in our community is that mask wearing has been more widely adopted, that people in St. Louis County are respecting our public health orders for the most part, and that's why we're doing better. We're doing better in St. Louis County because of the acceptance of the public health orders. And I'm proud of the folks in St. Louis County who have done that. They've brought us to where we are today and put us in the position where we can continue to have conversations with all of the stakeholders in every sector, every business sector in our community about a pathway to relax some of these restrictions while the rest of the state and the rest of the country is going in the wrong direction.
The largest school district in St. Louis County started to have in-person learning this week. What are you all's thoughts on that and what that will look like in the near future?
Well, most of our public schools in St. Louis County started the semesters virtually, and our public health department has recognized that the COVID transmission and the data among those younger students, grade school and middle school, now supports a pathway to at least a partial in-classroom or hybrid model for in-classroom learning. And we hope that schools are getting back in that direction. And I think a lot of them are. The largest school district, as you said, is headed there. I think the rest of the school districts will head there. But this is a big undertaking, moving from virtual to in-classroom learning in a hybrid model with all of these public health, public safety guidelines that weren't part of our school system a year ago. That's pretty complicated. But I think they'll get there. I think most of the schools will get there in October, and we'll see if we can get there for high school students. The older students, from age 20 all the way down, the younger you get, the less COVID you'll see. But still in those older students, the 15 to 19-year-olds, we still have a higher positivity rate, almost 8% among those students. And we'd like to see that come down a little bit. And we'd like to see that group of young people be more accepting of social distancing and masking guidelines. Are still a little resistant.
You guys announced the partnership with SLU.
Yeah.
You're working toward some new advances as we continue to tackle this pandemic. Do you foresee any challenges with convincing people to trust a vaccine and to be okay with what's next?
Well, we certainly have a subset of our population in our country, in our community, that is really resistant to vaccines in general, and we'll have to recognize that. But the vast majority of folks recognize the benefit of vaccines, and influenza vaccine is an example of that. But this particular virus has been so devastating that it's my hope that people who generally are resistant to vaccines will accept this, because we need to get a significant portion of our community vaccinated to move forward and to move out of this. This virus is real, it's devastating, it causes significant loss of life, it will cause significant long-term health problems for some people who survive the virus, and we have to respect it, and we have to get our population vaccinated. There's going to be a lot of public health effort from an education standpoint to help people understand that we're being cautious about getting this vaccine into the market, so we know that when it arrives it will be safe. We're following all of the normal processes in our country to make sure it's a safe vaccine. But when it's approved, we need to see rapid, widespread adoption. It's very important to get us to the other side of this.
Speaking of vaccines, with the flu season approaching, do you foresee any issues or challenges dealing with these two issues, flu season and being in a pandemic at the same time here? Money-wise, any type of challenges with that?
Well, that's why we're offering free vaccines to the St. Louis County Health Department. Anyone that goes to our webpage, stlcorona.com, and clicks on the Schedule a Flu Shot button can get a flu shot at our South County location in Sunset Hills or North County location in Berkeley. But we know that flu season brings a whole lot of sick folks with it, and a lot of those people end up in the hospitals, and we need to be very cautious about overloading our hospitals when we're seeing a lot more COVID patients. The rural hospitals are now becoming overwhelmed, and some of those patients are now starting to flow into the hospitals in the urban areas. Doug, do you have anything?
Anybody else in the room?
Any other questions?
Some people, one more question for you. Some people have fear of going to get the flu shot with concerns that that will make them more susceptible to getting COVID-19.
No, it's important to understand of the flu shot does not protect you from COVID, protects you from the flu. But it's very important to protect yourself from the flu and to make sure that you don't get the flu and give it to someone else, because having 2 respiratory pandemics at the same time is not 1 + 1. It's much broader than that. It has a much broader multiplier effect in the way it overwhelms our community. But getting a flu shot will in no way make you more susceptible to COVID.
I think some people are just concerned about the going somewhere to get it. Let's say going, are there?
Yeah, so
parameters?
we have, most of the time in our community, that's a good point to make. Most of the time in our community, you get your flu shot at your employer in normal circumstances where it's okay to get around people. But we've, a lot of employers have made different, opportunities to get your flu shots, drive-through opportunities, and everyone can check with their employer. But that's why the Public Health Department has established drive-through flu shots at our health centers. And you don't have to get out of your car. And we'll give as many people a flu shot as can get an appointment and get to one of our facilities. But a lot of, even CVS and Walgreens all of our pharmacies are providing flu shots. Your doctor can still give you a flu shot. And if you can't get one from your employer, call them and ask them what they've done to allow you to get a flu shot in a socially distanced manner. But we are taking all of those precautions, and you can get in and out of a flu shot in a few minutes, and a few minutes of contact with a healthcare provider when you both have a mask on is an extraordinary low-risk event with a high reward of preventing flu for an individual, but also keeping flu from spreading through our community.
Are there any plans in the near future to increase the capacity at which the businesses are operating right now?
Well, we're in constant communication with all industry stakeholders, from the youth sports industry to restaurants and other retail, to hotels. We're in constant communication with them for a pathway to expand their capacity that keeps people safe. We're in a better place in St. Louis County than the rest of the state and many places in the country, and we're getting ready to go into the winter months where the stakes are high, the risk is high, and we expect to see more COVID. So we're trying to prepare for that. We have great partners in the community that are having very frank and open and very productive conversations with our health department about how to do some extraordinary things that are different to keep people safe, so they'll have confidence when they go to a restaurant, they'll have confidence when they go to a retail establishment or to a banquet hall or to a hotel conference room, that they'll be safe. And we want to make sure that we can do that. We understand the economic toll that this has taken, and we're working very hard with all of our partners, and they're working in good faith with us to find a path forward.
Thank you.
Okay?
Thanks,
Thanks.
Thank you.